session we will be basically talking about two divisions of the trigeminal nerve, that is the ophthalmic nerve and the maxillary nerve, and we will be looking at its course and of course its clinical integration. And the next lecture we will be looking at the mandibular nerve along with all the parasympathetic ganglia. Okay, so that is our plan. Let us now begin with the trigeminal nerve. Now the trigeminal nerve, as we understand, it has got three divisions: ophthalmic, maxillary and the mandibular. We will be actually beginning the this lecture by looking at the foramen which are used by these nerves for exiting, right? Let me start with that. So right now we are looking at the foramen of skull, and we have removed the calvaria. We are looking from the superior view and we are looking at the anterior cranial fossa. This is the middle cranial fossa. This one is anterior cranial fossa and this one is posterior cranial fossa, right? Now here we can see that this wing is the lesser wing of sphenoid and this is the greater wing of sphenoid. Fine. Between the lesser wing above and the greater wing below, we have a fissure which is called as superior orbital fissure. Now understand with me that if we pass a wire from here, this wire will enter into the orbit, and who is sitting on the orbit in the orbit is the eyeball, right? And with the eyeball there is attachment of the extraocular muscles, right? So what ideally should pass from this fissure? Obviously the one who has something to do with the extraocular muscles, that means the nerves which are supplying them, right? So third, fourth and sixth nerve are the motor nerves which will pass from the superior orbital fissure. Is that fine? Yes. But it is not only the motor component or the motor nerves which are actually exiting through this fissure. There is sensory nerve as well. So which sensory nerve will use this foramen? The answer is ophthalmic division, right? So if we understand that we have this nerve V1 which is actually passing from the superior orbital fissure. Next division of the trigeminal nerve, that is V2, will pass from the next available foramen. And what is that? That is foramen rotundum. That is foramen rotundum. So this is V2. And the very next is the mandibular nerve which will pass from foramen ovale. So we have three nerves passing through the consecutive foramen. V1 from the superior orbital fissure, V2 from the foramen rotundum, and V3 from the foramen ovale. Okay, along with the mandibular nerve, there are other structures as well which will pass from foramen ovale, right? And just behind foramen ovale, we have this small foramen which is called as foramen spinosum. All right, I hope this is clear to everyone, right? So this is the the foramen from where the structures are passing through. This foramen spinosum, what structure will pass from the foramen spinosum? See, when you look at the foramen ovale here, the mandibular nerve will go out of the foramen ovale. Suppose this is the foramen ovale, the mandibular nerve goes out of it. As soon as it exits, it remembers that, oh, I forgot to supply the meninges when I was well within the cranial cavity. That means now what should I do? I should send one nerve back into the cranial cavity in order to supply the meninges there. So the nerve going back is called as recurrent meningeal nerve. Because it passes through the foramen spinosum, it is called as nervus spinosum. Is that okay? Yes. So after having understood these foramina, let us proceed and understand the course of the ophthalmic nerve and the maxillary nerve. Okay. And to understand the maxillary nerve, one more orientation is required. And what is that? See, when we are looking at the superior orbital fissure from the cranial cavity, from the superior view, it looks like we have a fissure here between the lesser wing above and the greater wing below. Fine. But if we rotate the skull and we are using the frontal view, when we are looking from at the orbit from the frontal view, how this will look like? How this will look like? This is how the frontal view of the orbit will look like. And we have, this is again lesser wing, this is again greater wing, and between them we have superior orbital fissure. So what we are looking at right now is the superior orbital fissure. Just above it, we have optic canal. And now here we can appreciate one more fissure which is along the floor of the orbit. It is inferior orbital fissure. Why this is important? Because the maxillary nerve will continue here along the floor of the orbit. And once it is in the infraorbital canal, this is called as infraorbital nerve. That is nothing but the continuation of the maxillary nerve. Is that okay? So what I have told, superior orbital fissure is there. For the ophthalmic nerve, we have inferior orbital fissure, which leads to the canal along the floor of the orbit, which will be used by the maxillary nerve. Fine. After having understood this much, let us proceed with the three divisions of trigeminal nerve. This is the picture that shows what we have already discussed. This is the trigeminal nerve here, the ophthalmic division, the maxillary division, and the mandibular division. Fine. Now see, the nucleus of trigeminal nerve, it lies in the pons, and from this nucleus we have two roots for the trigeminal nerve. One is the big, which is sensory root, and one is small, slender branch, that is the motor root. The sensory root, actually it will make one ganglion which is called as trigeminal ganglion. Trigeminal nerve is like, mainly it is sensory, because you see two divisions are pure sensory. From the trigeminal ganglion, ophthalmic division and the maxillary division will be given off, which are pure sensory. But along with these sensory fibers, one motor root will join the mandibular nerve. So eventually mandibular nerve will become mixed. So we have ophthalmic nerve sensory, maxillary nerve sensory, and mandibular nerve mixed. Fine. Now we can see here that from the pons, our nerve is coming as two roots, sensory root, and this one is the motor root. Sensory root is making the trigeminal ganglia. And now it is important to see, this is the ophthalmic division, which will divide into further three branches, and these branches are approaching superior orbital fissure. Okay. Then the second division, maxillary nerve, which exits from the next available foramen, foramen rotundum. Okay. And the third division is the mandibular nerve, which will exit from the foramen ovale. But the mandibular nerve sensory branch is joined by this small motor root. Okay. So it becomes basically the mixed nerve. Is that clear? Yes. Now that we have understood this much, what are we going to do? We are going to make a schematic diagram. Okay. And with the help of schematic diagram, we will be learning the further course, right? All right. So what we have learned, that this is our brainstem. This part is the pons. Above we have midbrain. Below we have medulla oblongata. Okay. And from the pons we have this sensory root coming, that is making the trigeminal ganglion, which will eventually give three branches. Okay. And there is one slender branch coming, that is motor root, like this. So we have this nerve ophthalmic branch coming from here. This is ophthalmic V1. This is V2. Okay. And this is V3. Now these two are actually going to make the trunk of the mandibular nerve. This is the motor root. This is the sensory root. And this one is trigeminal ganglion. Okay. This foramen from where the mandibular nerve is going out is foramen ovale. Okay. And the maxillary nerve will pass from round foramen, which is called as foramen rotundum. Okay. And the ophthalmic division will divide into three branches, which will pass from the superior orbital fissure. Yes. So we can draw here that we have superior or orbital fissure, and below the superior orbital fissure, as we have understood, we have inferior orbital fissure, which leads to the canal along the floor of the orbit. Yes? Okay. Now one important point here, that this V1 and V2, they actually pass through the lateral wall of cavernous sinus as well. Okay, they will pass through the lateral wall of cavernous sinus as well. So this helps us remembering, this schematic diagram will help us remember that these are the nerves present along the lateral wall of the cavernous sinus along with third, fourth nerve, and the sixth nerve passes through the cavernous sinus. Okay, although latest edition of Gray's says that the maxillary nerve is not along the lateral wall of cavernous sinus, just like mandibular nerve, it is outside. But the latest edition of, or the recent edition of Harrison says, Harrison is still telling the previous thing, that is the classical teaching, that maxillary nerve is also along the lateral wall of cavernous sinus. So we will follow it. That is a standard book, isn't it? So now we need to understand that we have the trigeminal ganglion made by the sensory root here, and we have V1, V2 and V3. What happens next is this. We have three branches from the ophthalmic division, and what are these? This is lacrimal branch. The lacrimal branch will pass through the superior orbital fissure and it will go and supply lacrimal gland. It will go and supply lacrimal gland. Okay. What about this? This is nasociliary. And this one is frontal. Now frontal will go and divide into two branches, supratrochlear and supraorbital. It will go and divide into two branches, supratrochlear and supraorbital. Fine. Now the nasociliary nerve is actually holding one ganglion here. It is holding one ganglion here. What is the name of the ganglion? This is ciliary ganglion. What is the name of the ganglion? It is ciliary ganglion. So when it holds the ganglion means it is the topographical nerve for the ganglion. It is not functionally related, only holding the ganglia. Okay. And who is the functional nerve for the ciliary ganglion? The nerve to inferior oblique. Okay, which carries the fiber from the third nerve, which are eventually coming from the Dinger-Westphal nucleus, right? Now, this nasociliary nerve, which is holding the ciliary ganglion, will give some branches. What are these branches? This is going to give these branches. The continuation of the nasociliary nerve is in the form of anterior ethmoidal nerve. It will also give posterior ethmoidal nerve. Along with that, it will give long ciliary nerves and infratrochlear nerves. Infratrochlear nerve. Fine. So this is about the anterior, anterior ethmoidal, posterior ethmoidal, long ciliary, infratrochlear are the branches of the nasociliary nerve. Okay. So what we have learned about the V1 division. Okay. And before I proceed and take you to the diagram and explain the branches, till now what we have learned, let me just summarize and then we will go to the diagram and see all the branches. Okay. See this. So we learned that the sensory root and the motor root, they are attached to the bones here, and the sensory root, which is actually making the trigeminal ganglion. From the trigeminal ganglion we have V1, V2 and the V3. These are the sensory fibers. V3 will be having additional motor fibers when they are passing through the foramen ovale. Okay, and then finally they make the trunk of the mandibular nerve, which is mixed. Okay. Ophthalmic division will divide into three branches. One is lacrimal, one is frontal, the third is nasociliary. Lacrimal nerve will pass through the superior orbital fissure. This we have drawn here is the superior orbital fissure. And it will go and supply the lacrimal gland. Nasociliary nerve will hold a ganglion called as ciliary ganglion and will give certain branches: anterior ethmoidal, posterior ethmoidal, long ciliary, and the infratrochlear nerve. Anterior ethmoidal is basically the continuation of the nerve. Okay, and there is another one more nerve is there, the small short ciliary nerve. The short ciliary nerve is actually having certain branches from nasociliary as well. Okay, that much detail is not required. Just remember few communicating branches are given along the short ciliary nerve as well, which are basically carrying the sympathetic fibers. Okay, so these are the important things that we should be focusing upon. And what about our frontal nerve? Frontal nerve will divide into supratrochlear and supraorbital. Okay, supratrochlear being the medial nerve. All right, now let me take you to the diagram and let me explain the branches till now, and then we will discuss after that the second division of trigeminal. Fine. So here in this diagram we can see what is this is trigeminal ganglion, right? Here we can see V1, V2, this one is V2, and the marked foramen is the foramen rotundum, and this is V3. Okay, so V1, this is V2, and this is V3. Now the trigeminal first division of ophthalmic is actually dividing into three branches. Let us follow each one. This nerve is frontal, and we can see it is actually dividing into two branches, supratrochlear and supraorbital. We appreciate the frontal is dividing into two branches, supratrochlear and supraorbital. And we can also see there is this nerve which is actually going to the gland. What is this gland? Lacrimal gland. And what is this nerve? Lacrimal nerve. Are you guys understanding? This is lacrimal nerve, and the previous one that we have discussed giving two branches was the frontal nerve, right? Now after having understood these, we can see this nerve. This is the nasociliary nerve, which is actually holding this ganglia. What is this ganglia? Ciliary ganglia, right? Now let me explain the branches of the nasociliary nerve. Here we can see the nasociliary nerve is giving this branch here and this branch here. Two branches are given off. This one is anterior ethmoidal and this one is posterior ethmoidal. And both of them, they can be seen here piercing the roof. So where they are eventually going from the orbit, they are proceeding towards the anterior cranial fossa. Are you understanding? What is there in the anterior cranial fossa? The meninges. Meninges in the anterior cranial fossa are supplied by anterior and posterior ethmoidal nerve. Are you understanding now? And the anterior and posterior ethmoidal nerve are nothing but the branches of nasociliary nerve. Anterior ethmoidal nerve will not end there. It has further course. I will discuss about that in a moment. Okay. For time being, understand, I have shown you these two branches. One is anterior ethmoidal, the other is posterior ethmoidal, right? And then you can see there is this branch which is actually passing beyond the gland. You can see it is coming out here. Okay, let me use another color here. This nerve, I think you can appreciate here, this nerve is infratrochlear nerve. So anterior ethmoidal, posterior ethmoidal, and infratrochlear. Okay, all right. What about the ciliary nerves? Let me show you this. To understand the ciliary nerves, we can see the ciliary ganglion. This is ciliary ganglion. This is the ciliary ganglion here. And with respect to ciliary ganglion, we have these nerves which are post ganglionic branches, which are short ciliary nerve. But then we can see these branches which are actually coming directly from the nasociliary nerve. This is nasociliary nerve. They are passing in parallel with the short ciliary nerve. They're coming directly from the nasociliary. These are long ciliary nerves. I hope all the branches of ophthalmic division are clear to you guys. Yes, please write in the chat box whether you have understood up to this much. If everything is clear till now, so far so good. Clear? Yes, very good. All right. So now that we have understood the ophthalmic division, all the three branches, let us understand about the maxillary division. Now what happens to the maxillary division? See, this is the maxillary division here. That is the second division of trigeminal nerve. Now it will pass through the marked foramen, that is foramen rotundum, okay, and eventually it will be passing along the floor of the orbit. Eventually it will be passing along the floor of the orbit. That I have already explained in the infraorbital canal. Once it is in the infraorbital canal, it is called as infraorbital nerve. So we can say infraorbital nerve is nothing but the continuation of the maxillary nerve. Yes, we can say that. But in order to reach this part of the orbit, it has to first pass through this region. Now, what is this region? Let me explain. See, what is this plate? If I ask you what is this plate, you will say this is pterygoid plate. Fine. If I ask you what is this, you will say it is the palate part or the maxilla part. Fine. Now, if there is a gap between the pterygoid on one side, palate on one side, what are you going to name it? Pterygopalatine fossa. So this gap here is pterygopalatine fossa. So the nerve is passing through this region, through the pterygopalatine fossa. Are you understanding? Yes. Now, within this fossa, we can see one ganglion. Within this fossa, we can see one ganglion. What should be the name of the ganglion? As simple as the name of the fossa, that is the pterygopalatine ganglion, isn't it? So basically, when the maxillary nerve is passing through the region, it will hold the ganglion. So what is the relationship with the ganglion? It will become the topographical nerve for pterygopalatine ganglion. Is that clear? Yes. So that we can draw a schematic diagram for the maxillary nerve as well, where we have already drawn up to the foramen rotundum. Okay, we have drawn up to the foramen rotundum. Further course we can draw, and we have now understood that it is going to pass through this region, and of course it will be holding the ganglia, and then eventually it will pass through the inferior orbital fissure. I hope this much is clear. Okay, let us go to the notes part and let us draw the schematic diagram. Okay, because you see, learning, we have to first learn and we have to make our concept clear. At the same time, we must be able to draw it schematically so that we have the organized notes with us. That is the whole idea of the class, isn't it? So now you see, we have infraorbital fissure here, just below the superior orbital fissure. And as I told you, this will lead to a canal along the floor of the orbit. Okay, we can say that. Now our nerve, which has already passed from the foramen rotundum, will pass through the infraorbital fissure, and then it is running inside. So we cannot see from outside. So I am drawing it dotted manner. It is passing through the canal along the floor of the orbit. Okay. Once it comes out, it will divide into the cutaneous branches, which will take care of the lower eyelid to the upper lip. So it will be taking care of the lower eyelid to the nasal and the lip part. Okay. So I can write the palpebral branch, the nasal branch, and the labial branch for the superior labia. Fine. So that is the territory. Okay. And of course, now that we have understood that this portion between the foramen rotundum and the inferior orbital fissure, it is nothing but the pterygopalatine fossa. So if I draw one ganglion here like this, can I write pterygopalatine ganglion here? Yes, we can write it, because that is the part, that is the ganglion which is available in the fossa. Fine. Now look at the orbit. Just below the orbit, what do we have? We have the palate, and in the palate we have the teeth. Okay. Teeth are present in the upper jaw and the lower jaw. So in the upper jaw part, we say superior alveolar process, and the teeth of the lower jaw are called as inferior alveolar process. Are you understanding? So we have superior alveolar process, upper teeth, inferior alveolar process, lower teeth. For them we have nerves. So superior alveolar nerve for the upper teeth, inferior alveolar nerve for the lower teeth. Yes, only one difference is there. Inferior alveolar nerve is a single nerve which will pass into the mandibular foramen. It will travel through the bone. It will keep on supplying the teeth. But superior alveolar nerve is actually 3 set of nerves are there. So we have anterior superior alveolar, middle superior alveolar, and posterior superior alveolar nerve. Okay. So what I have described, let me draw and explain it again. Okay. So what I have told, that below the orbit we have palate here, and in the palate we have superior alveolar process. For the superior alveolar process, we have 3 branches coming. That one is posterior superior alveolar nerve, posterior superior alveolar nerve, and one is coming from this part. Again, from this part, this is anterior superior alveolar nerve and middle superior alveolar nerve. So basically we can say that we have 3 superior alveolar nerve. Out of these 3, anterior and middle are the branches of actually infraorbital nerve. You see, this portion is actually called as infraorbital nerve, which is nothing but the continuation of maxillary nerve. So anterior superior and middle superior alveolar are the branches of infraorbital nerve. Posterior superior, on the other hand, is a direct branch of maxillary nerve. Is that clear? Are you guys understanding? Yes? Are we done up to this? Is it clear? Yes? Okay. Now, two important things that I want to tell. One is about the continuation of the anterior ethmoidal nerve that we will be talking. But just before that, pterygopalatine ganglion is only topically related to the maxillary nerve. That is fine. But what is the functional nerve for pterygopalatine ganglion? It receives the fibers from greater petrosal nerve. So greater petrosal nerve is actually giving the preganglionic fiber to the pterygopalatine ganglion. Okay. What about the postganglionic fibers? How the postganglionic fibers will be delivered to the lacrimal? Because you see, the pterygopalatine ganglion is held by the maxillary nerve, whereas lacrimal gland is supplied by the lacrimal nerve. So what do we need here? We want a communication so that the fibers which have reached here in the pterygopalatine ganglion, like this, they must be delivered to the lacrimal. Okay, let me write the pathway and then I will explain. So what happens? We have greater petrosal nerve, which reaches the ganglia, and there is a relay. Postganglionic fibers will be delivered by zygomatic nerve. Zygomatic nerve actually divides into 2 branches, zygomatico temporal and zygomatico facial. Both of them, they are going on its own pathway. Like zygomaticofacial and the zygomaticotemporal, they have their own region to supply. Zygomaticofacial will supply this prominence of the cheek, zygomaticotemporal in the temporal region. Okay, but this zygomaticotemporal will give one communication branch to this nerve here. This is the lacrimal nerve, which is actually supplying this gland, lacrimal gland. So our pathway for the postganglionic fibers is this. Our pathway for the postganglionic fiber is this. We have the zygomatic nerve, and zygomatic nerve is, we have the zygomaticotemporal. From the zygomaticotemporal, this will be the pathway, and this is how the lacrimal nerve and the lacrimal gland. Fine. Is it clear? Have you understood? That means in our diagram, if we draw, I can draw like this. we have the zygomatic nerve, which is actually passing through the infraorbital fissure here. It will give its own branches, but it will give one communication here. Okay, so this nerve is the zygomatic nerve, which will keep on giving this branch to the lacrimal nerve and finally reach the lacrimal gland. Yes, so this is how it happens. Now let me show you. Okay, now let me show you in the diagram all the branches that we have discussed till now. Okay, one of the question you are asking about the incisive foramen. That incisive fossa is for the, you see, the nasopalatine branches are there. Okay, now let me show you the remaining branches that will complete our topic. I think now you can understand it in a better way, that we have this foramen rotundum and the maxillary nerve is passing through it. Then this is passing through this region, that is the pterygopalatine ganglion, and we can see the posterior superior alveolar nerve is a direct branch. Anterior superior and the middle superior alveolar nerve are actually given along the floor of the orbit. Do you appreciate now that we have three set of superior alveolar nerves? Okay, and now here I am going to write this as Z. What is Z? Is the zygomatic nerve. Okay, zygomatic nerve can be seen to be divided into zygomaticofacial, and this is zygomaticotemporal, and this zygomaticotemporal is giving this communication branch where it is going to the lacrimal nerve, and the lacrimal nerve is finally reaching the lacrimal gland. Is it clear to everyone? Is it clear? Yes. See, the pterygopalatine ganglion, it gives major supply to the lacrimal gland, but it is not the only destination. In fact, the palatine, pharyngeal and the nasal, all these small glands also receives the fibers, the parasympathetic fiber from the same ganglia along the other nerves. Okay, like the palatine nerves are there. Okay, so along the other nerves of distribution, they will also supply the other small branches, small glands. But the most important part here is the lacrimal, and this is the pathway. Okay, and I have given you the schematic diagram, also I have shown you the pathway and the nerves. I hope yes, it's clear. Very good. All right, now before taking the question, let me just talk about the anterior ethmoidal nerve. As I told, anterior ethmoidal nerve is a continuation of the nasociliary. Okay, let me just show you. Now examine this diagram. We are looking at these nerves from above, and we can see that there is this nerve which is actually approaching the lacrimal gland. So I know for sure this is lacrimal nerve. Fine. I can see this nerve which is actually going to divide into two branches. So this is frontal, which is actually dividing into supratrochlear and supraorbital. Fine. Okay, and then I can see this third nerve which is giving these two branches. What should be these branches? This trunk is the nasociliary nerve, and these branches are anterior and posterior ethmoidal nerves. Is that okay? Yes. Now anterior and posterior ethmoidal nerve, if I want to see the further course, I should remove this plate of the bone. If I remove this plate of the bone, if I do the dissection, then I will be able to see the further course. Yes. So let us do that. Let us remove this part of the bone and let us see the further course. Now here in this diagram, we can see the anterior ethmoidal and posterior ethmoidal nerve here. Yes. As we have seen, they are going from the orbit into the anterior cranial fossa. They will supply the meninges. But anterior ethmoidal will not end there. By the side of crista galli, by the side of Christagalli, anterior ethmoidal will enter into the nasal cavity. So from the orbit to the cranial fossa, from the cranial fossa to the nasal cavity, right? Let me show you how it enters into the nasal cavity. Here we can see anterior ethmoidal nerve enters into the nasal cavity. Once inside the nasal cavity, it divides into medial and lateral branches. Now, medial will supply the septum of the nasal cavity, I mean nasal septum you can say, and the lateral wall of the nose is supplied by the lateral branch of the anterior ethmoidal. Okay. Now, this lateral branch is further going to give one branch which will come on the outer aspect, which is called as external nasal branch, right? Let me show you. The lateral branch here is eventually coming out, and it is coming on the surface of the nose, and this is called as external nasal nerve, which is going to supply the tip of the nose. Now you see, if I take you few moments back, I told you this is the distribution area of the maxillary nerve, lower lid, nose, and the lip. So we have this understanding, this is the area of maxillary nerve. Yes, we do have, but at the same time we must be able to understand that you see the tip of the nose is actually taken care of by the external nasal branch, which is actually coming from inside, piercing and becoming external nasal, right? So external nasal branch of the anterior ethmoidal is taking care of your tip of nose. Is that clear? Yes. So let me add these also in the notes, and then we will take one question here. Okay. So what I have told, that from the orbit, the nerve is entering into the anterior cranial fossa. And from the anterior cranial fossa, the nerve is entering into the nasal cavity by the side of crista galli. Within the nasal cavity, it will divide into two branches, medial and lateral. Medial is going to take care of the septum. Okay, it will contribute in the septal supply, and the lateral will continue as external nasal branch. Lateral will continue as external nasal branch, and this is going to supply the tip of nose. Okay, which is important question for us. Tip of nose is supplied by external nasal branch of anterior ethmoidal nerve. Is that clear to everyone? Yes, have you understood? Now let us take this question. Which nerve lesion could produce the condition where stimulation of right cornea results in blinking of left eye but not the right eye? As I told you that our trigeminal nerve is the sensory division, yes, and for these structures, okay, and we know about the blinking reflex, right? So now the question says we are stimulating the right cornea, there will be blinking of the left eye, but not the blinking of right eye. What is your answer? Yes? Quickly write the answer in the chat box. Everyone? Okay. Now, see, let us discuss the anatomy here and then we'll come to the question. Okay. See, if I say, suppose this is cornea, right and left side. Okay, this is right side, this is left side. Okay, and we have this muscle, orbicularis oculi muscle is there. Okay, and here we have the brainstem part. Here we have the brainstem. In the brainstem, we have midbrain, pons and medulla. Midbrain, pons and medulla oblongata. Yes. When you stimulate the cornea, the afferent will be taken by this V1 nerve. Okay. Ophthalmic division of the trigeminal will be taking this afferent fibers when you stimulate the cornea. And how the reflex will work, see, these fibers will deliver the information to the fifth nerve nucleus, okay. And we have the seventh nerve nucleus here and the seventh nerve nucleus here. What is this nucleus? Seventh nerve. What is this nucleus? Seventh nerve. Now, when the fifth nerve nucleus has got the impulse here, it will fire and it will stimulate both side seventh nerve nucleus. Now the seventh nerve nucleus will fire. Eventually, seventh nerve nucleus will fire, and seventh nerve nucleus will bring the you see the blink. The blink will happen because of the seventh nerve firing, and the seventh nerve supplies the facial muscle. We all know that. Fine. So what is the pathway? Pathway is this: when you touch the cornea, afferent will be taken by the fifth nerve, or you see the fifth, the ophthalmic division of the trigeminal. Fifth, it will relay into the fifth nerve nucleus, which will fire and supply, which will make the seventh nerve nucleus fire, and the seventh nerve will, fire, and the orbicularis oculi will contract, leading to the blink. Now the question says, when you are touching the right cornea, left reflex is absent. How is that possible? What was the question? There is a blinking. No, left is present, only right is absent. Right is absent. Okay. So how it is possible? See, if the afferent is all right, it will go and stimulate, and it is also getting stimulated. So there is no problem on this side. But there must be a lesion here, so that the efferent part on the right side is affected. So what is our answer? Very good. Very good. Answer to this question is right facial. Yes, if you have understood this much, let me change the question and let me ask this question differently. Okay. Now see, if I say that this is gone, afferent is gone. Okay. I am touching the right cornea again. I am telling that the right trigeminal is gone and I am touching the right cornea. Now tell me, on which side blink will be absent? On which side blink will be absent? Quickly tell me. If you have understood the concept, quickly give me the answer. On which side reflex will be absent? Yes? Very good. It will be absent in both the sides. It will be absent in both the sides because the afferent itself is gone. If there is no afferent, there will be no reflex at all, isn't it? Right? So answer to that question and the concept, I believe everything is clear to you, right? So this was today's demo regarding this two divisions of the trigeminal. In the next session that I'll be taking on 25th, I'll be discussing the mandibular division along with all the parasympathetic ganglia, discussing its topographical and its functional nerves and all the clinical aspects. Okay, and we'll also take the questions. And this is my Facebook page, Dr. Sandeep Madaan, and I'm writing my WhatsApp number as well. This is my number, 9896542122. If you have any query or you want any guidance, okay, you are welcome. Okay, feel free to contact. All the very best.